phase 1 ગયો, 2 ગયો, 3rd હવે જસ્ટ પતવા આવ્યો છે.
હાજી.
અનફોર્ચ્યુનેટલી શું તમને લાગ્યો કોરોના?
Riya, let me tell you very frankly, from the first phase, second phase, and this is the third phase is going on. What is my experience I'm sharing with you? In the first phase, I have treated lots of patients of a corona because I was the only doctor to keep hospital open in this area without mask, without sanitizers, without gloves. And I have examined patient as is it routinely, as they have come as a patient, I have to examine them. And they almost all were having the corona. That was the first phase. In the first phase, there was no any protocol line of a treatment.
Okay.
There was
Right.
there was no any protocol line of a treatment. So we were treating the patient according to their complaint, their symptoms, and the signs which we are getting by means of a laboratory and by means of the CT scan. And according to that, I was using a higher antibiotics, and everybody responded well. Very few patients I might have, બહુ થોડા પેશન્ટને મારે જેને આઈસીયુના સપોર્ટ માટે મોકલવા પડે હોય, અથવા મારી હોસ્પિટલમાં તો ઓક્સિજન છે જ નહીં, અને મેં અપ ટુ ધ 70 ડાઉન ઓક્સિજન પેશન્ટને વિધાઉટ ઓક્સિજન સાજા કર્યા છે. I am not boasting, but there are a technique of the doctor who can treat like this, who is having a confident, not overconfident, only confidence. That's about the first phase.
જી.
Then second phase comes, what we say the delta.
Yes.
Second phase ની અંદર શું હતું કે લાઇન ઓફ ટ્રીટમેન્ટ, પ્રોટોકોલ લાઇન ઓફ ટ્રીટમેન્ટ, ઇન્ટરનેશનલ લાઇન ઓફ ટ્રીટમેન્ટ વોઝ એસ્ટાબ્લિશ.
True.
કે ભાઈ રેમડેસિવિર તો આપવું જ પડે, ઓક્સિજન આપવું જ પડે, પેશન્ટને રેસ્ટ કરાવવો પડે. એટલે ઇટ વોઝ અ પ્રોટોકોલ લાઇન ટ્રીટમેન્ટ, અને ઇટ હેડ રિસ્પોન્ડેડ વેરી વેલ, બટ સ્ટીલ lot many patients died. Lot many, because that was a very serious and severe variant,
Right.
which was causing the stony lungs.
Yes.
What I use words stony lungs, not it is a blockage or it is causing a block into the artery.
Stone in lungs.
No. It was making the consolidation of the lungs, and lungs become just like a stone. So there is no any further change in the lungs. You can't do any change, even though the patient you are in a very high, very good hospital, but we were restless. That is what I believe, and that is what my experience. There are 3 to 4 types of a corona. Very few people knows, only doctor knows. It's a patchy corona, consolidated corona, diffuse corona, resolution corona. So by seeing the CT thorax, if there is a written, it is a consolidated corona, it was the worst type of a corona, where the chances of death of a person were very more. But patchy corona, we can treat at home even. Resolution corona, you can treat at home, even in the hospital. So it is to the doctors who should know, and who should, as a general physician, very few doctors are knowing how to read the CT scan
Right.
plate.
Right.
If you are expert in that, you are the master. So in a first phase, none doctor attended the patient. Everybody kept their clinic closed.
Right.
So they were
Online.
not having the experience.
Yes.
After that wave, doctors thought we have lost a lot of money. If we would have treated, we would have got more money. So they have started in Delta treating the patient, but they were not knowing what is the treatment. And another most worst part, what was there, the government given only few hospitals, designated hospital to
Right.
treat the corona patient.
Right.
And government hospitals, they were treating the corona patient. I'm talking about the Delta. So what had happened? There was an overflow. All the hospitals were overflooded with the Delta patient.
True.
And it was very rarely examined by the doctors. Doctors were standing 6 feet away from the doctors, never auscultated, never do anything. Just they were watching all the displacement on the TV and what our instruments, but they have never touched to the doctor. only the paramedical staff, they have done all these things. And I doubt કે ઘણી હોસ્પિટલમાં એવું પણ બન્યું હશે કે નાનામાં નાનો પેરામેડિકલ સ્ટાફ હોય એને પણ કિટ પહેરાવી દીધી હોય ને એને ટ્રીટ કરવા મોકલી દીધો હોય.
હા, નકાબ
તમને
કે
ખબર
પીછે
ન
કોણ
પડે કે
હે.
આમાં ડોક્ટર છે કે કોણ છે.
Right.
વાઘા પહેરાવી દીધા, વાત થઈ ગઈ પૂરી.
So true.
The same thing had happened in the government hospital. They were not having any qualified staff
Yeah.
whenever Delta were there. એટલે આજુબાજુના ગામડાઓમાંથી, પ્રાઇમરી હેલ્થ સેન્ટરોમાંથી પેરામેડિકલ સ્ટાફને બોલાવી અને એ લોકોને જેને હાથમાં કોઈથી ઇન્જેક્શન પણ નથી પકડ્યું, કે જેને ગવર્મેન્ટના 30 દિવસ જ ગણ્યા છે. Because I have served in the government for 7 years. And how the bugger staff I know.
Yeah.
I know very well. So that was the main cause of a death of the patients. If you treat a patient very well, very nicely, we can save the patient life. But flow of the patient was so large.
So high.
And the treating staff was so untrained. That was the cause of the death. That is what. And no doubt Delta variant, not only in India, it has created havoc all over the world.
All over
You
the world.
name the country, majority of the patients have died.